afternoon, everybody, and thank you so much for joining us today. It's great to see everyone. My name is Jen Ebersole, and I'm the Senior Director of Public Policy with the Alzheimer's Association. And Luke and Ryan and I are excited that you're able to be with us today. And we have a lot of exciting things to share with you, and we can't wait to get to that. But before we do, we just want to take a couple of minutes to share with all of you a little bit more information about one of our other strategic initiatives that we have going on with the Alzheimer's Association. I have to say, we are incredibly blessed here at the association with some not only amazing advocates, which so many of you on this call today are, and many of you are involved with the association, not only as an advocate and an advocate leader, but you're also involved in a variety of other ways, such as, participating in Walk or The Longest Day, or as a community educator or awareness champion. And we would just like to take a couple of minutes to highlight another area of the association that is such an instrumental part of our mission, and invite others to learn more about this part of the mission, and just to learn a little bit more about that and invite you to think about whether or not that could be something that you're interested in learning more and exploring more about. And so I am excited to be able to introduce to you one of our amazing colleagues, Janie Sink. Janie is our manager she's our manager of program outreach from the Philadelphia or the Pittsburgh area. And I'm just so pleased that she's able to join us today to share a little bit more about awareness champions. So Janie, I will turn things over to you.
Yeah, thanks, Jen. And you cover a lot of ground. So yeah, I could see how you suddenly would be confused a little bit. She's everywhere, guys. So yeah, I have the honor of working with our Pittsburgh team and the Western PA volunteers. Many of you, I'm recognizing your names on here because some of you are already teaming up with us to be awareness champions. So today we just wanted to briefly share with you kind of what that experience is. And you're going to be hearing from one of your fellow volunteers in just a moment, and talk about how we can make this connection between delivering what we call awareness presentations and also doing while you're doing your advocacy work. You all came to us because for the most part, you had personal or professional connections to the disease. And that we love that because you're the ones who can make very compelling stories. You're sharing that with leaders in your community, persuading them to support us on various policies. And now this just takes it to a slightly another level. You're already presenting, but what you're going to hear today, you're going to hear from one of your volunteers, Mabel Washington, in just a moment from Bedford County, who's going to share some of her experiences with you and how she has raised awareness. And then I'm just going to kind of wrap it up by explaining briefly how you all can get involved. So Mabel, I'm not sure if you're with us at the moment, but Luke,
Janie, it looks like I think she's trying to connect. I'm not so sure if she was actually able to. We'll give just another 30 seconds, but we might need you to fill in a little bit for her.
No problem. Okay, well, while we're waiting on Mabel, so I'll just tell you a little bit about, you may be wondering, well, gosh, I'm an advocate, Janie. I'm doing a lot in that role. Well, one of the key things about being an awareness champion is what we're calling the volunteer role, is you're basically doing what you're already doing as an advocate. You're sharing your story, a compelling story that is very relatable. You're telling people about the impact and about our full mission work here at the association and our resources. Leaving people with a call to action, whether it's, sharing out our helpline, going to our website, setting up education programs, or, volunteering with the advocacy team. And so anyway, we wanted to, while we're waiting on Mabel, I'll tell you, you made the, with the timing of this is like a very critical time for us to get more people spreading awareness. As you all know, our facts and figures report just came out yesterday, and the numbers, unfortunately, are increasing. We know that this affects 6.9 million people who are living with it. And we need people to be comfortable going to their primary care physicians. Unfortunately, there are many communities, and you may know some. In fact, it might be in your own backyard, of people who are not comfortable because of the stigma or for various other reasons. Maybe it's inequities, lack of access to information and to specialists. So we really need to get them comfortable talking about it. So you and your roles, when you go out and talk to legislators, to different groups, you're basically giving an awareness presentation. And this is also of critical importance with the timing because of all the treatments that are coming out. We need people, we need to connect them with the resources and the treatments that are out there. So basically, and Luke or Jen, you can interrupt me when she's on. I just wanted to say briefly what the key role is for this position is to deliver brief awareness presentations on behalf of the association. And this can be to lawmakers, to community leaders, to different change makers in your community. You all are on the front lines, so you probably have a lot of ideas of different organizations and companies that you could be giving awareness presentations to. And these are short. So, we don't expect you to go out and give an hour-long presentation. We, depending on the audience, it could be a 5 or 10-minute conversation, or it could be up to maybe 20 minutes. And the idea is the key components of this are that you are first, you're sharing your value story. What brought you here, right? What keeps you motivated every time you go out and talk to someone about it, or every time you write a letter to the editor? It's sharing the impact. Unfortunately, as you all know, this impacts so many people. The people living with it, their caregivers and care partners. It's a very costly disease. And so, yes, so kind of driving that home, talking about the impact. Also, it's sharing resources and making sure that they know that there's help available to them. So those are kind of the 3 key areas. And then kind of sprinkled in there, we give you a foundation in what are the warning signs, what are things that people can be doing to modify their lifestyle behaviors, because there are things we know based off of research that we can be doing, such as sleeping more, which Luke has to probably remind me sometimes that I need to do that more. It's getting a balanced diet, right? All those things you learned as a kid, I kind of feel like we sometimes take for granted with our heart health, but that's all connected to our brain health. So that's also a key part of this message. And what's really great about these presentations, I mentioned that they're quick, they're brief. You can also tailor them to the crowd. So if you've got a lawmaker, definitely make it about that person and their constituents. If it's an individual, for example, who's in Greater Pittsburgh, who has part of their platform is on DEI and bringing health equity to their community, you can focus on, okay, how are the different underrepresented areas, how are they being challenged right now with the health disparities, and really focus on that. If it's, for example, if it's a women's group, and by the way, happy Women's History Month, you can make it all about, well, women are more impacted. We're more likely to be diagnosed, and we're more likely to be caregivers, as you know full well because of that facts and figures report that just came out. So really, we want you to tailor it to the audience, make it your own. We give you a lot of really great tools online to help you do this, and the short training, excuse me, frog in my throat. So the training is not complicated. We know that you're volunteers and your time, I get it. You don't have a lot of time. And what we ask you to do is basically fill out an online 3-question form to show your interest in the position, literally 3 questions. And then we ask you to watch a video, and it's pretty short. I think it's less than 10 minutes. That's going to give you a baseline of information. You're not expected to be a medical expert, but it gives you a good broad overview of what is Alzheimer's, how is it different from that and other dementia, and it kind of covers briefly some of those areas I talked about. And then finally, we give you, like I said, the tools, the digital tools to do the presentation, and you can make it your own. We have a PowerPoint. It's all designed for you. You can use the PowerPoint or you don't have to sometimes. Sometimes I know as part of meetings, chambers of commerce, maybe they don't have time for a PowerPoint. So you can skip that. Just make it your own, put it in your own language and share your story. My dad has
And
Alzheimer's. When I give
Janie,
away,
I was going to say, we actually have Mabel with us, and she has
oh,
become a whiz at being able to do
thank you.
that. So I hope you don't mind I'm interrupting, but
No,
she
please do.
has been able, Mabel is an amazing advocate. Many of you know her, and I would just love to give her just a couple of minutes to share
Sure.
how all of the things that you just mentioned, Janie, how she's been able to really put this into practice
Yeah.
in her community firsthand. So Mabel, hello. Thank you for joining us.
I
And you can go ahead and
all
share.
that. I can't believe you said all that. Hi, hi, Janie. How you doing? It's good seeing your face. I talk to you guys all the time, but seeing your face is sort of interesting because now I didn't expect Janie to look like that, and I didn't expect you to look like that. So there you go. I just had a different vision of you. Um, I think you're right on point. I think you're right on point. I don't see that it's not a hard job, and you wouldn't have. And I'm not talking to you professional people who get paid for it. I'm talking to the people that don't get paid for it. You wouldn't have done it if you didn't have a heart for it. You there's a there's I'll tell you a little bit about my story. I won't even tell you this. I'll give you the short version. And when you're talking to people, I find when I'm talking to people, I give you the short version or the long version, depending on the group that I'm talking with. And so none of the legislators, the government people, do not want to hear the long version. But you want to make the impact of give the nuts and bolts of your story. Because your story is what drives the wheel. Your story is what drives the wheel. People that you know is what drives the wheel. So my husband has dementia. He's had dementia. He was diagnosed. He was undiagnosed for 3 years, and he's been diagnosed for 13 years now, and he's 76. So now you can do the math. So we've been dealing with this for a long time. He was he's a football coach or ex-football coach, ex-football player. They weren't sure what to diagnose him as. Blah, 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 the whole 9 yards. We went through the whole thing, you know, the story. And it just ended up where they recently came up with the Lewy body, which sort of looks better for what's going on with him. So that's, so for 13 years, he started a business. He's a college graduate. He was a professional man. He worked for government. He worked in child care, juvenile justice system. He did all that. And we noticed that he was not functioning well. He was forgetting the places that he normally went, and he couldn't get there and back. So so that threw up a red flag, but the red flag went to another flag and to another flag. And then he killed a girl in a car accident because the red flags weren't taken care of. And then we went to the court system, the legal system, and it was a godsend that people in the community all know him and knew what it was about. And his lawyer said, it's a medical problem. I don't know what's going on. And that's when the diagnosis finally came around. But that was 3 or 4 years later. But anyway, so we've been in this for quite a while, this journey. And so when you tell the people the short story, that's my short story. And he has dementia. Now he has a care buddy. I work at the business that he created. And I'm not really good at it. I have good helpers, so I'm blessed with that. But I'm technically I guess I want to call myself a social worker by thinking. That's how I think, more like a social worker, not a business person. But anyway, so that's what I do. But when you go to talk, I wanted you to know my story. So when you talk to people, you give them what your story is, the longer version. I would do it a little more diplomatically, um, depending on the crowd. But you give them the long version or the short version. Government people do not want the long version. And so they just don't have time. And if you can get something in their hands so they could take back with them, that's a good thing. One of the things I wrote for you guys today was to say no. When Alzheimer's ALZ asks you to do something, if you don't have time, say no. They don't get offended by it. They just will say, we understand, whether they do or not, it's okay, but you have to take care of yourself. You have to take care of your family, so say no. And say, hey, how about if I catch up with you next month, or next week or whatever. I will do something, but I can't do it right now. The other thing that I wanted to say is you're not expected to know everything about Alzheimer's and dementia. And I add dementia in there because now it's an umbrella. They're not talking just about Alzheimer's, and people will pick up. I find that people pick up the dementia thing when I say it's not aging, because I'm getting old and I forget where I put my car keys, but it's when you can't ever remember where you put your car keys, or you can't remember what you had for breakfast. That might be a problem. And so they look at that, oh, I know somebody like that. So then you go with that. So that's why I don't overemphasize Alzheimer's, although this is the Alzheimer's group. I say Alzheimer's and the dementia. And they'll say, what is the dementia? And I know you don't have to know the medical. I don't know the medical terms for them. I just know what they say they are, and I let them go from there. But you're not expected to be the expert. You're not expected. You're expected to sort of give them the knowledge and open the door for them to go, at least I see, open the door for them to go through it. I just think that I have some really good partners. Mike is a great partner in my region. Sally Van Wy is a great partner in my region. And they're the people that know the political side of things. I know the terminology and I know the information. But when we go places, I team up with one of them because I'm going to talk about the people side of Alzheimer's and the dementias. And for you guys, I'm not going to say it all. The Alzheimer's stuff. And they know, I know the legal terminology, but they know the nuts and bolts of it all. They like that side of it. I like the other side. So we're a good team. So if you can find a partner to go with you, that's a great thing. One that you can help them with their weaknesses and they can help you with yours. And we work pretty good together. What else? Flexibility. Be flexible. When you go to talk or talk to a group, be flexible. I walked in the other day, a couple weeks ago, and I'm thinking, I'm going to talk to this group of people that work with caregivers. They work with elderly. And I'm thinking, what can I take? Because we're doing it over lunchtime. What can I take to this group that's going to be the icebreaker? So I took cookies. I just took cookies. They said, oh, you brought cookies. And I said, yes, I brought cookies. Because we're having lunch and I'm going to have my cookies first. And so we laughed about that and we went on. But they're an agency that takes care of people in their home, and they never get maybe to laugh and to joke and to just take time to have lunch. But that was the agency that provides caregivers. And I just wanted them to know that a little bit more about Alzheimer's and the dementias and what it really means. And Sally went with me, amen. Sally's a good partner. And so she had all the flyers and all the pamphlets. And so, and they said, oh, I think this will be good for my family. I think this will be good for so-and-so. And so that worked out well. And we had lunch, and we laughed, and we talked, and we're working on something else for our community. But think about when you go to talk to people, what's going to be the icebreaker? My thing is food. I'm a person, I like to eat, and my thing's food, and I like chocolate, and those are things. My husband has diabetes besides all the other things he has. So a lot of those things I don't have at home, but I have them at the office, and I can grab them and take them with me. So think about what you can do to be the icebreaker, to have an icebreaker when you go in to talk to people. I don't want to talk all the time. I just want to say that know your government people, know who they are, tap into the ones that tap into you. It's funny because Representative Joyce's office is Jennifer Markle is the contact person. I've gotten to know the people in DC, but Jennifer Markle is the one that is local, and she just had a grandbaby, her first grandchild. So what do? We took cookies that had little cookie blue things on them, little, please, food, there we go, food again. And so she was so tickled that we remembered that. When we went in, we remembered that. We took pictures of the cookies. It was us handing them the cookies. Everywhere we go, we take pictures and send them back to the Alzheimer's group. So know your people and who you're talking to, and what you can connect that they can remember you.
Yep.
Representative Joyce loves to read. He loves books. So I gave him a book about African Americans Underground Railroad in Bedford County. Well, he just thought that was catch me out. So he'll always remember that. He'll always remember that. What is the Senator Topper is from Bedford County and knows my children. So we talk football, basketball, stuff like that. So if you could figure out a connection, especially when you're talking to individual people or even your community, I decided that I was going to work in the community a little bit, Sally and I. So I know we're crazy. We went to the
So I think Mabel, I don't mean to cut you short, but we are going to have to keep things moving along.
But there's a lot of ideas that we have that we're doing, and I think that you're just a jewel, because volunteers are what drives the wheel. And so I just wanted to say we have a lot of things going on, and you guys know that. So we'll just keep going for our region.
Absolutely. And I think, if you take anything away from this, it is truly, Mabel and Sally, certainly they, as being awareness champions and just committed advocates, they use these a lot interchangeably, but it's truly about knowing your community and using that passion to drive that awareness. And, being an awareness champion, it's about just harnessing your story, using that as an opportunity to, provide information about dementia, all forms of dementia, and provide resources about the Alzheimer's Association and how to connect back to the association. Very short presentation. So absolutely reach out to Janie if that is something that you are interested in. Reach out to Luke Ryan or myself. It really is an amazing opportunity and just another way to be involved and help driving the mission forward. So without further ado, I'm going to turn things over to Luke for some exciting federal policy updates. So Luke, go ahead.
Yeah, thank you, Jen. Yeah, and thank you, Mabel, for sharing, and Janie for coming on. We have some really exciting news. If you were not made aware, yesterday, the Energy and Commerce Committee passed the NAPA Reauthorization Act, the Alzheimer's Accountability Investment Act, and the Bold Reauthorization Act. These are our top 3 priorities that we've been working on for some time, and the Energy and Commerce Committee unanimously passed that. And that's because of advocates all around our country who are informing their lawmakers on these important pieces of legislation. And that's why not only was it brought for a vote, but it was brought for a vote and passed unanimously. And so I do just want to give another shout out to Mabel and Sally and Mike, who may or may not be on the call. Congressman Joyce is the only PA congressman on this committee, and they did a phenomenal job at informing him and his office on these important pieces of legislation. So there's still more work to do on these policies, as the committee voted for it, but now it goes to the full House to be voted on. And so we still need congressmen to co-sponsor it. We still need the House to put it up for a vote. So there's still more work to be done through social media, through letters to the editor, and through messages to your lawmakers on advancing these policy priorities. So big kudos to all of you and to our advocates around our country who are informing their lawmakers on these important issues. With that, we have a new federal policy that we're working on. And we won't go too deep into this because we are still in the really early stages of this piece of legislation. But in 85% of cases, the initial diagnosis of Alzheimer's disease is made by clinicians who are not dementia specialists, usually primary care providers. And half of primary care physicians do not feel adequately prepared to care for people living with Alzheimer's or other dementia. And so we have some work to do on making sure that our PCPs, our primary care providers, are informed and feel comfortable caring for those living with dementia or needing diagnosed. And so we need to address the knowledge gaps felt by many primary care providers. And so this is what this policy aims to do. It is called the Accelerating Access to Dementia and Alzheimer's Provider Training Act. It's a long name, so we have an abbreviation for an acronym called ADAPT, the ADAPT Act. And so this will address the knowledge gaps and workforce capacity issues faced by primary care providers, who are the first stop for many people concerned about their cognitive abilities. This will provide a grant program that will issue training to primary care providers for free, and also increase this program to rural and underserved communities. So this is online education and training for PCPs to better understand detection, diagnosis, care, and treatment. Again, we'll have more information for you as this bill develops, and we become experts on it as well, and to be able to share it with you. And so we're going to be asking our legislators to co-sponsor the ADAPT Act, which again will empower primary care providers to better diagnose Alzheimer's and other dementia. And so we're really excited for this in the upcoming works. And we're really excited that since we are seeing progress with our other 3 priorities, that there's still more work to do to provide better access to diagnosis and quality care. And so with that, I will turn it over to Ryan.
Thanks, Luke. Thanks, everybody, for being here today. And so to Luke's point, we have a lot of momentum building behind these bills. And so what's next? Our biggest advocacy event of the year, Advocacy Forum in Washington, D.C., is coming up. Excuse me. And we will have representatives from every district across the country, and proud to say that we're going to have one from every district in Pennsylvania being with us in Washington, D.C., where they will all meet with their legislators in office and explain our policy priorities and ask them to co-sponsor them. And as Luke mentioned, these are coming out of committee now, which means that they will soon be coming up for possibly a vote. And so getting these in front of our legislators in person in Washington, D.C. will be a really big deal. And then once we get back, it'll be time for follow up to that, right? So we'll be asking all of our volunteers and advocates to work with us on things like letters to the editor, district drop-bys, district meetings in some places where we'll need to follow up. And then our regular letters, emails, our steady purple drumbeat will pick back up really strong after Advocacy Forum. And we'll include our new facts and figures. So yesterday, our facts and figures came out for 2024. Just more information, prevalence numbers on Alzheimer's and dementia nationwide, and then we'll also have the Pennsylvania version that we'll want to make sure that all of these lawmakers have. So when we come back from Forum, we're going to have a strategy in place to make sure that our lawmakers are hearing from us on the facts and figures and any follow-up from Forum. So stay tuned on all of that coming up in the next few weeks from your advocacy managers, from Luke and myself, and from Jen. And now I'm going to pass it on to Jen.
Actually, before we go there, we're going to pause. We're going to open things up. Does anybody have any questions about any of the federal updates that were provided so far? Let's take an opportunity to answer any questions that might be out there for folks. And of course, we'll have an opportunity at the very end as well. If any more questions would pop while we're going through some of the state updates.
I just have a comment. I really appreciated seeing all of those updates, and they're overwhelming. I printed them off and actually studied them. So I appreciate that, because just verifies just how important what we're doing is. Thank you.
It's exciting, Sally. There's a lot of progress, and that's the important part. And it truly is because of all the work that each of you on this call are doing. And that's what is truly exciting about these updates that are happening. So thank you for everything that you do. We're happy to be able to deliver this exciting progress. Okay. All right. Well, then I'm happy to move on to provide a little bit of an update on our state policy priorities. And I know I was excited to be able to provide a snapshot in our February Focus Our Aim recap of what our an overview of what our state policy priorities were. And we did a little bit of a deep dive, so I'm not going to go through all of that for you today. But I do have a little bit of an update and some progress to report on our state policy priorities. So our first priority to build a dementia-capable state infrastructure, and specifically our two asks within that particular policy, which would be building support for Governor Shapiro's proposed $1.9 million state appropriation to create an Alzheimer's and dementia division within the Department of Aging, and also support for Senate Bill 840, which would actually create that division within the Department of Aging. I will say that while there hasn't been any specific movement on the legislation itself, February, pretty much late February and early March, was a time where the legislature itself was in recess. They were back in their districts, but that was a time when, Governor Shapiro gave his budget address on February 6th. And that really was a time when both the House and the Senate appropriations committees held budget hearings. And that's really a time when the departments come before the appropriations committees and really learn more. They ask questions about the governor's budget, and each of the departments have that opportunity to defend what is in their budget priorities. And so we were really excited because we did work with some of the state legislators to include some questions in the round of the budget hearings to pose to the Secretary of Health and the Secretary of Aging in their budget hearings. And so we're just going to spend a couple minutes and share with all of you today what that looked like a little bit and how the responses were to those questions. So Luke, go ahead and you can play this is going to be Dr. Bogan. She is the Secretary of Health.
Senator Brown, followed by Senator Schwenk.
Thank you, Mr. Chairman. Good morning, Acting Secretary and team. Nice to have you here. The CDC has declared Alzheimer's and dementia as a public health crisis. And as you know, unfortunately, many Pennsylvanians are living with Alzheimer's and dementia, and their families are being greatly affected. I was very pleased that the governor did include my legislative proposal in his budget to establish the creation of an Alzheimer's and dementia infrastructure within the Department of Aging. Act 9 was also signed in 2022, which asked the Department of Health to implement specific measures and improve early detection and diagnosis as well. I'm just touching base with you on two quick questions on this. Did the governor discuss with you this proposal and your involvement in this proposal? And number two, what have you done as far as the Act 9 efforts as well within the department?
So the Department of Aging and the Department of Health and Department of Human Services, we're all meeting on a regular basis, and we are part of the discussions on the Alzheimer's work and the dementia work. You know, the Department of Aging put out a lovely plan that you all saw, and in that at the very back is a list of all the sort of action steps and their assignments by department of who's in charge of what. So there are quite a number of those steps that are assigned to the Department of Health that we'll be implementing and working on. So again, we're working with the Department of Aging on that plan. Do you have the answer to Act 9? And I'm going to turn it over to Kristen for your Act 9 answer.
Yeah, so just to go back to the current budget proposal from the governor. So we have had discussions with Department of Aging specifically about that legislation and how we can be involved from a public health side. I think that we, between the agencies, thought that Department of Aging really had that infrastructure to be able to successfully implement that program with support from the Department of Health from a public health perspective. Just to give you an update on Act 9, so in that legislation, we developed two websites, one for healthcare providers and one for the public, with resources, toolkits on early detection for Alzheimer's. And we will be updating that on an annual basis. So we're actively looking at those resources right now to make sure we stay current with all of those resources.
Okay, thank you very much. And one other question. So we're talking about diseases.
Okay, so that was the question that Senator Rosemary Brown, who is our champion, our lead sponsor for Senate Bill 840, posed to Secretary of Health, Dr. Bogan. And we're also going to look at, we had another question asked by Representative Brennan to Secretary Kavulich, who is the Secretary of Aging, during the House budget appropriations. So go ahead, Luke.
Brennan.
Thank you, Mr. Chairman. Thank you, Secretary. Well, I just had a quick question on the Alzheimer's division, this new division in the department. During the budget address this year, a lot of us were really excited to hear that the governor is proposing this new division. I've heard from tons of my constituents about supporting this project. I think a lot of these families really struggle. They're feeling alone, and this offers some hope. I was hoping you could just explain what your vision is and how we should be communicating this to our constituents.
Thank you. I'm so happy to talk about this. We're excited to do this, not just as the Department of Aging, but as partners in this space in Alzheimer's and brain-related disorders, looking to build out a system that works closely with the Department of Health, works with the Department of Human Services, and works with our stakeholders like the Alzheimer's Foundation, or the Alzheimer's Association, and the Jewish Healthcare Foundation in this space, and who have been partners for a long period of time. So we envision a division that works within the department, not only to do the research and make sure that we are up to date and doing the academic detailing on new medication that's coming out, but also aggressively program and provide caregiver support in communities and education in communities. The bulk of the dollars that we've asked for will be pushed out into community programming to make sure that we're uplifting this line of work, that we're connecting communities to the services that they need. When you think about it, that there's 404,000 estimated older adult caregivers of individuals experiencing just Alzheimer's alone, we know that the work is vast and that we need to do better in this space. So we're looking forward to enhancing what we have been doing for a number of years and really working with our partners to build out a much bolder system of service delivery for the individuals who have Alzheimer's or another brain-related disorder and dementia.
Is there any outreach expected? Is there anything that we should be doing?
Right now, the department works with the Alzheimer's Association to do outreach in communities. This will expand that role, but it also will expand what we do with the 52 agencies on aging to program and do outreach and to pull in other partners to have a greater impact on the communities across the Commonwealth.
All right. Thank you very much. Thank you to the governor, and thank you for moving forward with this project.
Okay. So just wanted to share with all of you, like I said, while there hasn't been a whole lot of movement, it's really because of this process that we've been going through with the budget hearings over the past month. Now, I will say that the legislature they were back in session this week. They will be back in session, in and out of session over the next month. We are still waiting to get some amendatory language to work through some adjustments that need to be made in the bill, but we are still expecting, we still have bipartisan support. We are still expecting this to be moving forward. And we are hopeful that we could see the bill moving sometime in April. And so stay tuned. We still have very good news. We absolutely will be letting our advocates know when is the right time that we'll be activating on this to generate support when we get the green light that it's ready to move. So while we're not seeing movement yet, it's still really great signs that there will be movement soon. And there have been some really important discussions taking place in the meantime. And I definitely wanted to share some of the public discussions that have been taking place as part of the budget meetings that are that had been going on. And then our second priority around improving access to biomarker testing. So Senate Bill 954 and House Bill 1754. Both of these bills would require state regulated insurance providers to provide comprehensive biomarker testing. We are still, the strategy that we have taken is that we are meeting with all four of the House and Senate insurance committees, still working with the insurance providers to come up with language that is palatable with all parties. And so we are still within that negotiation process. We are making progress with those negotiations, and we are hopeful that we could see a bill scheduled for a vote on or about April 9th. So again, we're still seeing some progress. We're hearing some good things. We're still in the negotiation process of that. And we absolutely will be sure that we're activating and letting all of you know when that legislation is primed and ready and we have the green light to move on that. But again, we are still getting some good progress and some good conversations going around that. And then the other thing I just wanted to let you all know, and you actually heard Dr. Bogan mention in her remarks in the appropriations hearing, the Department of, and actually you heard Secretary Kovulich talk about this as well, and actually I know some of you were aware of this. The Department of Aging, they did release what they are calling their Aging Our Way PA, a lifelong plan for independence. Basically is a master plan for over the next 10 years that really provides a roadmap for how Pennsylvania's aging population will be aging in place and really keeping our growing aging population independent and aging in place as long as they can and thriving in our community. And so they released their draft plan. And we did provide significant comments to them. We were excited that they did include some dementia-specific recommendations in there. Some were more general, but still had some impacts to the dementia community. And so we did submit significant comments back to the Department of Aging. We would be happy to share with anyone what our comments were back to them. But we anticipate that final plan will be available within the next coming month or so. And we anticipate being an active partner as part of that process moves forward. So next slide. So all of that culminating to a reminder that we do have our Pennsylvania Advocacy Day coming up on Monday, May 6th in Harrisburg. And I know several of you have already registered for Pennsylvania Advocacy Day, which we thank you for that. If you haven't already done so, we hope that you will mark your calendar to join us on Monday, May 6th. We have an exciting day planned. Our Advocacy Day will include, of course, meeting together for a brief training session and group meetings to kind of review what your meetings will be looking like in the morning. We do have a press conference scheduled for noon in the main rotunda. And I'm excited to say that we have confirmed Secretary Jason Kovulich, the Secretary of Aging, will be joining us. In addition to our lead prime sponsor and legislative champion, Senator Rosemary Brown will also be joining us. And then the afternoon will be filled with meetings with our lawmakers. And then we will also have, of course, an opportunity to meet with other advocates, from across the Commonwealth to be attending as well. If you are coming from anywhere from the western part of the state or the eastern part of the state, one thing I do want to let you know is that we will be chartering a bus coming from the Monroeville area. So it'll be at a location that is conveniently located just outside Pittsburgh so that you don't have to go into the city. But it will be like a ride and share in the Monroeville area. The same thing around the King of Prussia area. So if that is something where transportation is a need for you, please do let us know. When we send out our next iteration of our announcement for our registration for Pennsylvania Advocacy Day, we will have that noted with a link to be able to let us know if you need to take, if you would like to take that as an option. So just again, we will have transportation as an option, a chartered bus coming from that Pittsburgh or the Monroeville, King of Prussia area. If that is something that you'd like to take advantage of, we will have that option available for you this year. We're trying to get as many people as possible joining us this year. As you heard, our state legislative priorities, these are the biggest asks that we've had. And it is so important that we have as many people as we can join us in Harrisburg to get these policy priorities across the finish line. So please bring people with you, mark your calendars, and plan to join us in Harrisburg on May 6th. Next slide. And then our asks. So I don't want to leave today without a call to action. So what we are asking for folks to do today or within the next few weeks, one of the things that we are really trying to drive action on right now is to send a letter to the editor or consider penning a letter to the editor. And this is just a way that you can submit, and we have sample or suggested letters to the editor along with some guidance on how to walk you through what to do. A letter to the editor supporting Senate Bill 840 and the governor's proposed $1.9 million to create an infrastructure. And so we would be happy to work with you on that. But basically what we are asking for folks to consider doing is writing your, taking the draft or the suggested draft that we have available and just inserting your own story or making it in your own words, and working with us to submit a letter to your local newspaper, and seeing if that would be something that they could get published. And so if this is something that you're interested in, please do let us know. We really are looking for ways to get these letters to the editors published in as many local media outlets as possible. The letters to the editors are sections that our lawmakers really do look at. And so if you haven't done one before, and this is something completely new, we would love to help walk you through that process. And please know how important these are and how much our lawmakers do pay attention to them. So please let us know if this is something you're interested in. We would be happy to send you that template with the suggested wording and kind of walk you through that process. We can link you up with our Marcoms team to help you through that process. Also, if you are connected to a company or an organization, or you're connected with a decision maker in your organization, we also are asking for letters of support on behalf of an organization that we could send to the Appropriations Committee chairs, asking for support of Senate Bill 840 and the governor's proposed $1.9 million. So again, we have sample partner letters that we can share with you. So again, if you are connected with an organization or a company, we'd be happy to work with you to help generate a letter of support as well. So just again, feel free to be in touch with us and we can help walk you through that process. And I think that's everything for today. So we would love to open things up for questions. Just a reminder, our next Focus Our Aim is April 18th. So please, again, be sure to join us. Mark your calendars for Thursday, the third Thursday at noon, April 18th. That will be our next Focus Our Aim. But we do want to make sure that we're opening up for questions. Pam, awesome. We'll definitely, awesome. Pam and Robin, we will be in touch to do letters to the editor. You guys are awesome. Thank you.
I think Lynn had her hand up.
Yep, I see you have a question, Lynn.
Oh, sorry.
Yeah, I had a question about the biomarker legislation.
Sure.
And particularly for people who might get the test and they have early onset. But having been involved in the clinical trial at Penn Memory Center, they actually did my biomarkers, but I chose not to know at this point. I don't have symptoms because some of it is very stressful, and Penn feels strongly that people should have counseling if they're going to do this, because especially if they're early onset and they find out they have the biomarker but don't have symptoms yet, it could be something that might interfere with them getting insurance or getting admitted into assisted living in the future. So I didn't know if anybody was considering that in the legislation. It's something that should be considered really carefully, and maybe that should be part of your work with the insurance companies, because if you're going to get this biomarker and maybe they will deny you insurance or deny you admittance into care later.
Mm-hmm. I mean, that's Lynn,
Maybe, maybe nobody is aware of that, but that was Penn's concerns about. They feel strongly that if you're going to find out about your biomarker, that you should really have some serious counseling before you take the test.
counseling. So are you talking about more of like the care management counseling, like?
Well, just, and even your own psyche counseling. They have you sit down with someone to decide whether you really want to know this at this point. Now, it's different if you're on Medicare because they're going to cover these things, but it's particularly for the early onset folks. It's something to consider, and maybe in your discussions you want to think about.
Yeah, no, and I definitely appreciate that. And there actually is, and it's something that I can certainly take back, Lynn, because I can say that there is, and I don't have it at my fingertips, there is actually a cost savings factor when there is that early diagnosis. So when you have that biomarker test and it is something that you're catching early and linking it to a treatment, there is a cost savings there, and it's pretty significant. So with, with relation to the denial, the insurance coverage denial, that's a piece that I admittedly, I'm just not quite sure how to address. But something I will look into, but appreciate you raising that.
Yeah, I think it was Jason Karlowitz from Penn who wrote an article about it. So if I can find it, I'll share it with you.
Yeah.
Just the considerations that you should, personally, I'm being tested in the clinical trial, so I will know, because they're doing scans and things. But
yeah, and I mean, I will say too, one of the other pieces of, and this is something that's critical, even that could potentially relate to our new federal priority, the ADAPT Act. Care planning is such an important piece of education for physicians and the primary care workforce, so that when there is a diagnosis and that diagnosis is disclosed, those next steps are really critical, and getting the appropriate care planning. Counseling is one of them. I mean, I hear what you're saying about the pre-counseling prior to getting something, but it's also that, okay, let's say once there is a diagnosis, that care planning then is that next critical stage, and the counseling is part of that. And making sure that our primary care workforce, that continuing education is a piece of that, is really important. Pam, I think did that answer, or at least partially, Lynn? Pam?
Yes, I just wanted to support Lynn on that, because I know when my husband was diagnosed, we had been thinking about getting long-term care insurance. And when we went to get it, then we were denied because he already had the diagnosis. And I know with my daughter, she's involved in the DIAD program and is on a trial. The people through DIAD had told her to make sure she had insurance in place, and told her she should have counseling before she did the testing to see if she had the genetic mutation. So I do think that's very important. I'm glad Lynn brought it up.
Yeah, thank you for reinforcing that, Pam. Yeah, really important points.
Yep, Denise?
So just to follow up on the ADAPT Act, I understand it's pending, but for those of us who may be visiting our PCPs soon, is this something that we maybe have a discussion about? Is there something that we can encourage them to do to help in this process? Can you frame that a little bit? Or are we just not in we're not there yet? And what, what should we do?
Jen, you can interrupt if you want, but I don't think we're there yet, right? With the policy legislation. it's very early. It just got introduced. And so, you know, it does go off an existing grant called Project Echo, which we could go into at a later time. But at a later date, there might be more that we can do with our PCPs.
Yeah. Yeah, and I think from the policy perspective, from the ADAPT Act perspective, that in and of itself is very new in the process. But from the larger framework from that health systems perspective, Denise, we are doing a lot of work through our health systems to try to change from that local health system policy perspective to make our health systems policy more age friendly and more dementia capable. And there is Project Echo it does currently exist, and there is a Project Echo Alzheimer's and Dementia continuing education component that currently exists. It's just not readily available all throughout. And that's what the ADAPT Act would build upon. It would make it more available to more clinicians. And so that's what we would want to do. And especially for more of our rural communities in Pennsylvania, could be beneficial. Yeah, so, but like Luke said, it is the act itself is very new. And it is in the infancy stages. It's going to take some time. We're in the building process for that legislation itself.
I wanted to know if we could do something now to help push that along, but thank you.
Yeah, we will be ramping that up here within the next several weeks for sure. Yeah, it's still very new. But we appreciate the enthusiasm for sure. Any other questions?
Yeah, Mabel, and to everyone, we will send you the draft letter to the editor and the follow-up email with the recording and the slides. That will be readily available for all of you in the follow-up. Okay. Any other questions?
Great. All right. Well, thanks everyone for joining us today, and we hope to see you on our next Focus Our Aim.
Thank you.
Take care, everyone.
Thank you.
Thanks all.